Not all dental implants are the same. Dr. Sargon Lazarof of Sargon Dental, who invented, designed, and pioneered the use of ultra-tooth implants, reveals why these are superior to other dental implants.
I started my practice in Beverly Hills, and a few years into it, I came up with the idea of an implant that could replace the current implants by being immediate. The current implant technologies, you lose a tooth, you have to take it out, let the area heal, and then once it heals, you've lost the gum and bone. Then you have to do bone grafting, gum grafting, then place an implant, wait months for it. And if everything works, all the surgeries work, then you get a tooth. Well, my idea was that instead of doing that, when we remove the tooth, we can place a screw that expands and locks and holds everything, the gum and the bone and everything. And if there's bone missing, we can add it right there and put a tooth on it because it's stable within bone.
Dr. Lazarof explains why the design of this implant is so effective.
The implant being an expandable implant, the shape of it was a Eiffel Tower versus a regular implant, which is just a screw. And when you put an Eiffel Tower, it's much more stable. So when the patient chews on it, all the forces go deep in bone, not in the shallow area. Now, the regular implants, after several years, you see the threads showing because all the forces are on top. So you lose bone. So you see somebody smiling, a few years, you see threads of the screw. With this, that doesn't happen. And plus, when we looked at the bone condition, when this implant is expanded and puts pressure on the surrounding bone, the density of the bone increases. So even the quality of the bone was better. So the long-term data came out, now we have about 30 years data on this, that it stays the same as the day we place it, and it gets better and better with time. The only device that is FDA cleared for immediate tooth placement is the Ultra Tooth. There's no such thing that you walk in and get teeth and walk out, except Ultra Tooth. We have patients that come in, emergency, they just broke their tooth or their teeth. They walk in here, they fly in here, one appointment, they walk out with a tooth.
Who is a good candidate for the Ultra Tooth procedure?
A good candidate is anyone that is losing and has lost a tooth. Before you replace a tooth, you want to think about Ultra Tooth because when you place it in that socket, you preserve the shape of the gum and the bone that it came out of. So it saves you a lot of headaches.
Dr. Lazarof discusses how the smile design process gives the patient the best results.
Smile design is something that it's extremely important because we can do all the implants or Ultra Teeth in the world. Patient cares about the way it looks and the way it feels. The final result is I want a smile that fits your face and personality.
Receiving a new smile is often a life-changing experience for patients.
I'm very proud to say that in dentistry, we have reached the dream. In other words, we are able to replace a body part with a better part that was there. We know it's titanium, it's much stronger than natural tooth, and we can make it any color and shape any we want. It doesn't decay. We've been changing people's lives. It's amazing how many people walk in with tears because they're losing their teeth, and they walk out with tears of happiness because they just got their teeth overnight. Full mouth reconstructions, we put the patient to sleep, they wake up with brand new teeth.